Hi, I'm Dr. Norman Lamberty, OBGYN physician in Montclair, California, and founder of ANA Women's Health. This is the first of a webinar series for our patients. We're going to start with COVID-19 and pregnancy. What is COVID-19? COVID-19 is a new strain of coronavirus. Coronavirus is a large family of viruses that are known to cause diseases in the range of the common cold to severe diseases like SARS and MERS. MERS stands for Middle East Respiratory Syndrome, while SARS stands for Severe Acute Respiratory Syndrome. COVID-19 compares to these two syndromes in a way that it attacks more than just the upper respiratory area of the patient. So far, COVID-19 has been known to attack the lungs. It can cause clotting, as well as a new multi-system syndrome on children, very similar to Kawasaki syndrome. How do I protect myself and my pregnancy? Number one, and most importantly, is social distancing. The best way to practice social distancing is what we have done so far, which is to stay home. That's where you are the safest. But obviously, most of us will have to go out and venture into the world again and try to live a normal life again. And we can. To practice good social distancing as we go out, we should stay away from other people at least 6 feet. This will prevent acquiring the disease, even when the person coughs or sneezes. Second, washing your hands. This is probably the second most important part, because the way that we acquire the disease is not really through the air. It's really by touching an area where the virus has been deposited and bringing that virus to our nose or to our face with our own hands. So it's important that we wash our hands, and let's go over how. We should simply wash with soap and water. There's really no need for hand sanitizers unless there is no soap and water available. We should wash for at least 20 seconds. Now, when should we wash our hands? After touching anyone. Anyone who doesn't live in our home, anyone that we encounter outside of our home, we should go and wash our hands, because that person can be carrying the virus within their clothes, within their hands, within their body. After touching any surfaces outside the home, or touching any items that we bring from outside the home to our home. After going to the bathroom. After changing diapers. After blowing our nose. After coughing or sneezing. After doing dirty laundry. As we come back to our home and we bring our laundry from outside, which is exposed to the virus, we should remove that and obviously launder it. Because we touched it, we need to wash our hands. Before eating, something that most of us do routinely, now we really should make a point to do it every single time. And before breastfeeding or handling our breasts, expressing, pumping, we should wash our hands. Cover your coughs and sneezes. In addition to simply covering when you cough or sneeze, you should cover with soft tissue. That soft tissue should be put in the trash can, thrown away, and you should wash your hands. If there's no tissue, then instead of covering with your mouth, you should cover with your elbow, and then obviously wash your hands and elbow. Clean and disinfect frequently. Any surface that has been touched by anyone outside of the home, any item that frequently gets touched by your own hands after coming in contact with other areas outside of the home should be disinfected. For example, your iPhone, your tablet, your computer, any electronics that you use, any item that your earphones, your hat, all those things need to be disinfected as you bring them back to your home. A disinfectant doesn't have to be purchased. A very natural disinfectant that will kill the virus is simply mixing 2 parts of water and 1 part of vinegar and putting into a spray bottle. Launder items. Launder items at the maximum appropriate temperature for that particular item. Obviously, we don't want you to damage your items, but you want to use as much temperature as possible. The virus thrives in cold and doesn't quite make it in warm weather, even though warm weather doesn't kill the virus, but it doesn't allow it to thrive. So therefore, we should always use as hot water as we can. Now, a note about masks. Obviously, it's become the latest fashion item in not only our country, but all over the world. There are some rules that we should follow with masks, and the CDC has some specific guidelines for us. First of all, N95s are not needed outside of a healthcare worker dealing with a person who has the virus or can potentially have the virus. So there's no need for N95s. The recommendation is simply a cloth mask that covers your nose and mouth. That cloth mask should be worn at all times when we're in public. These masks should be worn by patients 2 years old and older. Less than 2, there's too much risk of suffocation, so we should not have masks on our children less than 2 years old. These masks can be disinfected, and the recommendation for cloth items is so that we can launder them, so that we can disinfect them at home easily. Risk in pregnancy. There's no real evidence that pregnancy offers any higher risk than the rest of the population when a person acquires COVID-19. Now, pregnancy by itself puts the patient at higher risk when certain infections are acquired because of the changes in the body caused by pregnancy. Specifically, the respiratory system gets affected, so any kind of infection of the respiratory system may become worse in a pregnant patient. Now, after saying that, so far, maybe pregnant patients have been protected better than others, but there's no evidence at all in the data that pregnant patients have gotten sicker, have gotten more admitted to an ICU than the rest of the population. So we should follow all general universal precautions in protecting ourselves against the virus. Can the virus affect my pregnancy or the baby? The placenta seems to offer some protection to the baby against acquiring the virus. There's been already reported many cases of patients that have acquired COVID-19, but the babies have come out and been tested negative for the virus. So even though we don't know exactly the science behind it, even though we don't know exactly how the placenta protects the baby, it seems to offer some protection. Babies that have acquired the virus seem to have acquired the virus after the baby's born. Therefore, the CDC recommends that we protect the baby against a mom that has the virus or against other adults that have the virus. So initially, after birth, CDC recommends that we separate baby and mom. But there are certain actions that should be followed, and CDC still recognizes the many benefits of breastfeeding. Therefore, if mom wants to breastfeed, she is definitely allowed. And this should be a decision taken not only by mom, but including the healthcare provider, including the rest of the staff in the hospital, so that really is a group decision where we put in the balance the benefits and risks of breastfeeding our baby versus the exposure that the baby may have to the virus. Following the guidelines that we mentioned before in washing our hands and protecting ourselves dealing with breastfeeding should protect the baby or keep the baby from acquiring the virus from an infected mom. What to do when I have symptoms? You definitely need to seek help if symptoms that are associated with COVID-19 appear. You could look for help from your primary care physician, as well as from hospitals and emergency departments. So what are the symptoms? What are the most common symptoms that we look for from COVID-19? Number one, a persistent cough, shortness of breath and difficulty breathing, fevers and chills, muscle pain, a sore throat, new loss of taste and smell. Any of these symptoms or a combination of them that is persistent beyond simply a small allergic reaction or a simple cold, you should look for help. Now, when should we go to the hospital versus simply visiting our primary care physician? If there's true trouble breathing, if there's persistent pain or pressure of the chest, new confusion, inability to wake or stay awake, bluish lips or face. These are all signs and symptoms of low oxygen. Your body is unable to bring enough oxygen to your organs, specifically the lungs and the brain. And so for any of these symptoms, any one of these symptoms, you should go to the nearest ER. Medications, treatment, and supplements. You must be wondering, are there medications to treat COVID-19? Are some of the medications that are used in the hospital safe during pregnancy? Are some of them going to hurt my pregnancy? So this is really a very complex question that requires multiple answers. Number one is that there's no treatment for COVID-19. I mentioned earlier, there's no vaccine, there's no treatment for COVID-19. The treatments are to help your organ systems improve or get better while your own system fights off COVID-19. Most of these medications are safe in pregnancy, but every individual needs to be evaluated separately. The team of health professionals should always consult with you about the safety of these medications, and you should always keep that in mind before taking any of the treatments. This should be a question for every healthcare professional. Is this medication okay with my pregnancy? Whether it's in the hospital, whether you get a prescription from your primary care physician, and now you're at the pharmacy, at any of those points, you should be aware that some medications may hurt the pregnancy and some don't. Now, with some of them, your healthcare professional may be putting in the balance how COVID-19 may also affect you and your pregnancy. And you may need to take some risks as far as some medications may not be tested in pregnancy at all. So we don't know, and there may be reports that the medication could potentially hurt a pregnancy, but there's no proof. All that needs to be discussed with your healthcare professionals. Another common question is whether we should be using supplements to fight off COVID-19. Well, there's no particular supplement to be able to fight off COVID-19 or to boost our immune system enough that it becomes immune to COVID-19. But talk about the immune system, the only way that we can protect ourselves against acquiring COVID-19 or against acquiring a severe form of COVID-19 is by boosting our own immune system. And there's many things that we can do to boost our own immune system. Some of them are, again, some of the things that we recommend all the time. Healthy eating, exercise, have enough sleep, a multivitamin on a daily basis doesn't hurt. All these things really help us protect ourselves by keeping us healthy, therefore keeping our immune system healthy. Now, some supplements directly augment the ability of our immune system to fight off disease in general. And these are vitamin C, antioxidants, and zinc. Now, this doesn't mean that we need to overload on vitamin C, because that definitely has not been proven to help us fight off COVID-19 specifically. But in general, we can take a supplement of these on a daily basis, and that'll help us. Montclair Hospital, the hospital where I deliver most of my patients. I want to say a few notes about Montclair because I find the situation there special and very convenient for this entire crisis and very protective of our patients that are pregnant. Number one is that the labor and delivery unit is located in a separate building from the rest of the hospital where COVID-19 patients are being treated and evaluated. So when you're pregnant, you don't really have to come through the emergency department. You come through the front door, through admissions, 24 hours a day, 7 days a week. You're walked back all the way to the labor and delivery unit in a separate building and completely separated from the rest of the hospital. Number two, Montclair Hospital has managed to continue to accommodate a family member along with our pregnant patient, whether the patient's being evaluated or simply the patient's being admitted for a scheduled C-section or admitted in labor. Very convenient and very family oriented, even during this crisis. Number three, there's testing being done of all patients that are having elective procedures done. For example, if a patient is coming in for an elective C-section, she gets tested for COVID-19 2 or 3 days before the procedure, therefore keeping the labor and delivery unit free of COVID-19. Even if there is a patient that is pregnant with COVID-19, there's a negative pressure room in the labor and delivery unit to be able to house this patient and not expose anyone else in the unit. Thank you very much for joining us on our first webinar from ANA Women's Health. We offer regular appointments as well as telehealth appointments for your convenience during this crisis.